Hello friends, this is a patient of capillary hemangioma of a young child. So capillary hemangioma usually occur in a young children and it's a more superficial lesion and it is from the small capillary vessels, and most common location is for dorsum of the tongue or oral cavity. So the incidence is less than a cavernous hemangioma, but still they need to be treated. So the most important, peculiar complaint of this patient is bleeding and difficulty. So in this particular patient, there was a large capillary hemangioma over the dorsum of the tongue. So we decided to take this patient by laser. So ideally, this patient should not be biopsied, and the laser fulguration is the treatment of choice for this patient. So what we have to do with the laser beam, so this is a carbon dioxide laser with a handheld carbon dioxide laser probe. So we are fulgurating the surface of a capillary hemangioma, and laser works by the principle of vaporization. So this is the one of the best way of dealing such sort of lesions. So here slowly and layer by layer. So we are just taking the tissue off. So by means of coagulation the surface, so it is vaporizing the abnormal tissue, and our aim is to just reach the normal tissue. So this patient should not be done with the bipolar cauterization, or ideally they should not be done with bipolar cauterization or unipolar cauterization or any excision, because one, they tend to bleed a lot. Secondly, in case of bipolar cauterization, so there is a lot of slough and these patients are more prone for infection then. So ideal way of treating this patient is by carbon dioxide laser. So it's a slow way, but it's a more secure and a definite way. So here we are slowly taking the we are vaporizing the tissue, and the surface vaporization is important along with the marginal vaporization. So once we are sure, so we are reached the deep muscles layer. So we don't have to go beyond the muscles, and here we are just taking the last layer of the cavernous hemangioma of the muscles, and underneath it we can clearly see the musculature. So here we are just taking the the tissue with last layer from the muscle, and once we are sure that we have removed all the layer, so just on all the edges, so just take the laser and then coagulate all the edges. Or even if you want to take 1 or 2 stitches at the bleeding area to underline the vessels, we can also take that. But avoid using any sort of coagulation or any open take or a cold knife surgery in this patient. So once this patient starts to bleed, and they are very difficult to control the bleeding. So ideal instrumentation of choice in such sort of patient is the carbon dioxide laser. So here we are just making sure that all the edges are well secured, and hemostasis should be done from all the places. And then there's a small bit. This may have some satellites. So very carefully under your loops, you examine any satellites are there. So here this is a post-operative, immediately post-operative, and the carbon dioxide laser, there is hardly any edema, and patient is almost pain-free. Thank you so much.